All right, this is the virtual presentation week. It's the last event before our keynote tomorrow, and what better way to end with Dr. Charles and learning a lot about blockchain. So we're going to be learning a lot about good information in regards to blockchain, because I never even heard of blockchain until I met Dr. Charles. So we're going to get some really good information today. But before I share it to our sponsor, our keynote and our gold sponsor, let me just give a shout out real quick to our sponsors that are here. These sponsors here that are part of this event, that made this event happen: VALA, Virginia Assisted Living Association, Senior Living Guide as our supporting sponsors, and of course our exhibitor sponsors, GenCare Senior Medical Center, Bayada, Aegis, Sciences Corporation, Commonwealth Senior Living, which I believe we have somebody from Commonwealth here today, Mako Medical, Carlton Building Services, Comfort Keepers, Morrison Living, Prime Plus Senior Center, and National Physiatry. As you all know, we do have somebody from National Physiatry here. Silver sponsor is Next Chapters of Virginia. Our gold sponsor, who's going to be speaking with us today, Caption Call, and of course our keynote sponsor, Anthem, Michael Hall, my brother from another mother, and I'll let him take the screen, and I'll be quiet.
Good afternoon once again, and thank you, Micah. You can tell he does very well under pressure. If that would have been me, I would threw my hands up and say, I can't do it today. I guess I'll see you tomorrow. But definitely taking this under pressure. And technology is something, but definitely once again, grateful to be a part of this beautiful 2-day run so far of these presentations, a wealth of information. I've just listened over the past couple of days and just hearing from even the last one, just the cleanliness, just how we should be cognizant of what we should be doing and wiping down certain areas, how we interact with one another. And thinking of that, I was just asked a question, I believe, from Stephen and also Lisa before this call came into being about the plans and stuff that we carry and what part of the division I'm on, which is on the Medicare side. And I heard a lot in regards to institutions and Anthem outside of our regular Medicare supplement plans and the Medicare Advantage plans that you hear so often from the Joe Namath commercials and all those commercials you see every once in a while that pertain to Medicare. Anthem has provided last year for the first time in all areas of the state an institutional plan, and it's designed to follow our members from their homes into communities, whether it be into a nursing facility or assisted living. Some of those plans are even catered to our members that are living still in their senior apartment complexes that can provide an extra level of care with more hand-holding for our members. So it's just amazing, once again, of what Medicare has allowed health plans to do over these past few years in catering to our members and making sure they have what they need. But thank you, Michael, for this opportunity. And I will pass this over to my beautiful partners, Stephen and also Lisa.
Well, thank you, Micah 2.0. And just to piggyback off of that, we are so thankful as well to be a part of this wonderful educational program and to be able to speak to professionals and this senior care channel. Just to make this quick, since we have been cut short on time, I know many of you have already kind of seen us talk about Caption Call, but just to reiterate that, you know, we are very passionate about making sure that you have this program, this product in place in your facilities, in your business, in your home care efforts to make sure that anyone that you serve that has hearing loss is able to accurately understand those very important calls. Some can be critical health care, post-acute care calls. Some may be as just simple as an I love you from a grandchild or a family member. So just know that I will be reaching out and we will do whatever we can to help serve you, better serve those that you care for in this wonderful industry. And I'm going to turn it over to Steve, our resident audiologist and business development director, if no one has met him yet, and he will do a great recap as well.
Thanks, Lisa. This is probably the third time. I think most of you have probably heard this, so maybe some of this will sound familiar. But thanks. We're happy to be here. Yes, I'm an audiologist. Been working with Caption Call for a few months now, and trying to develop educational programs and access for all of our customers A little bit about hearing loss in general. Approximately 30 million Americans are suffering from some type of hearing loss. And if you look at those numbers, only about 25% actually do anything about it. And usually takes them about 7 years before they even get around to trying to do anything about it. In the meantime, these hearing loss issues are going untreated, undetected in most cases, and we know in the data now that it can lead to many comorbidities, social anxiety, isolation, cognitive decline, dementia, depression, higher risk of falling, and other health concerns. So hearing loss is becoming much more of a concern these days. A recent study of 14,000 individuals, it's a market track survey, showed that of the different listening situations, talking on the phone was the second most important situation for most people, second to one-on-one communication. And especially during the pandemic, as Lisa pointed out, it's a very important time to stay connected, but very critical also for the hearing impaired user to stay connected with their caregivers, medical industry, family, friends, and other services. So a very critical need for those with hearing loss. NIDCD estimates 1 in 3 people in the US between ages 65 and 74 have a hearing loss, and nearly half over 75 do. And then age is the strongest predictor. So as we get older, the predominance of hearing loss becomes greater. 91% of adults with hearing loss are age 50 and over. Adult men in their 50s are 3 times as likely to have a hearing loss versus women of the same age. And as we get older, men and women get older, those numbers become a little bit more closer. And then in general, women might have more difficulty with lower frequency sounds. And then bottom line really is to seek a professional, seek audiology or hearing care professionals' help for a full hearing evaluation, especially if you reach age 50, it's probably a good time to get a baseline hearing test. How are we in business? It's an ADA Title IV back in 1990. It was created for the hearing impaired, and we work closely with the Federal Communications Commission regulation to provide this no-cost service. And we are funded by a surcharge on everyone's phone bill, essentially, and we're paid by the number of captions delivered successfully. So it's not about phones being disseminated into the field, it's about successful captioning. We provide the ability for individuals to turn captions on or off as they need. So we're not really forcing them to use it, but the phone, as you can see there, is a very nice device, very easy to use, like a normal phone. And then patients with hearing loss are certified by caregivers, and then that gets communicated to us, and then we then take the ball and create the process to get the service implemented for the patient or resident or individual in their own home. And then we also follow CDC guidelines, and we wear PPE if we do access any of those facilities. And then just finally about the phone itself, the phone has a hands-free, there's many features on this phone. If you go to the website, it'll show you everything, but the hands-free is very useful tool, and allows the person to free up their hands, and especially for hearing aid consultation. This way they can read and hear and then manipulate their hearing aids with their hands. So it's a nice feature to have on this phone. And then finally, if they are a little bit maybe more sophisticated on the go, want to go out to a courtyard or move around a little bit, we can create a connection between Bluetooth cell phone to an app to the phone, and you can actually take your mobile device and take captions with you. And that's compatible with iPhone, iPad, and now with Android. So a very sophisticated service, and we're, again, just trying to get awareness out there that this service exists and it's available to everyone. Thank you.
Thank you, sir. Thank you so much. And without further ado, we're going to go right to Dr. Wendy Charles. Stephen, if you can, or Lisa, stop sharing so that way Dr. Charles can share. There we go. Okay, Dr. Charles, it's all you.
Wonderful. Thank you very much for inviting me, and I'm so pleased to be part of this event. I am This is a wonderful product, and I'm so happy to have also followed Caption Call. In my household, we have, my husband is 57 and has experienced profound hearing loss. So we use captioning for everything, including my presentations, to make sure that everyone can experience the full, the full component of the presentation. I wanted to first start out with a disclosure and disclaimer. So of course, anything that I say is not necessarily representative of my employer, BurstIQ. And I just really wanted to give a wonderful shout out to Micah Hunt for all of the organization and effort he put into bringing us all together today. And I am eager to share information with you that I hope will be impactful. So today, my goal in this short period of time is to cover a lot of material, but I'll start out by talking about what blockchain is and how it operates from a non-technical perspective. We can recognize opportunities to use blockchain to connect assistive technologies and identify basic ethical and operational issues for connecting data resources. So I will talk about some real products, but I'm not going to provide the brand names so that the intent is not to be promotional and to maintain continuing education credits for those who seek them. So starting out with blockchain 101, first and foremost, blockchain is not Bitcoin. Bitcoin does operate on a blockchain, but by itself, blockchain is not Bitcoin. The best way to think about blockchain is that it's actually a class of technologies and tools. So you can see at the bottom circle here that there is Bitcoin, which most people have heard about as a cryptocurrency, and there are also many other types of cryptocurrencies. And actually, cryptocurrencies make up only 15% of all uses of blockchain now. So blockchain is so much bigger than cryptocurrency. There are other aspects that I'll be talking about called distributed ledger technologies, and blockchain has evolved to include the term distributed ledger technologies. And ultimately, these are all forms of distributed database. So among the characteristics of blockchain in general is that blockchain uses ledgers. So instead of storing information in tables, which I was trained to do, and that we most think about for data management, instead data are stored on a ledger. And so when you add information, you write a line. When you take away value or information, you write a line and you append new information on the ledger. Next, blockchain uses cryptography, and this is an important component for how information is secured. So as you can see on the left side here, any type of input is put through an algorithm that we call a hash function, and it has an output that we call a hash sum. Now you don't need to remember all these details, but the most important consideration is even when two items are very similar to each other that you would put in, the output is very, very different. And that's important for encryption. So when information is put on the blockchain as a hash sum, it's so complicated that people cannot reverse engineer back to what that input was. And these hash functions can take in any type of information, whether it be raw data or whether it be a file or an entire batch of data. It will always produce the same type of hash sum output that was regardless of the size or complexity of information. So next I'll explain how these hashes are used to connect batches of information together. So when, depends on how the system was designed as to how much information is necessary in order to create a batch. And we call a batch, we refer to it as a block. And there is a hash sum that summarizes all the contents of the block, no matter how complex it was. When, after the hash is created and starts forming the next block, the next block contains the hash of the previous block. And so that's how they are linked together. This is also the feature that makes these blocks tamper resistant and tamper evident, so that if someone were to try to change any of the information in block 2, Because there is a sum that includes the totality of the information in block 2, and that is contained in block 3, you would have to change this hash in block 2 and then change the overall hash in block 3, and so on and so on. So while it's not completely immutable, the National Institute of Standards and Technology uses the term tamper resistant and tamper evident because it is hard to change the contents, and we can see whenever someone has tried to do so. So the next thing to consider is that blockchain uses a different way of storing information. So normally we are so used to just having a central database that we log into and that all the information is stored in one place. Sometimes banks or other organizations use regional hubs. But the problem is what happens when that server goes down? What happens when there's malware or the information has been held ransom? And that's a huge risk when we deal with health information too, which is so valuable. So instead, blockchain uses a distributed mechanism of storage. So each of these dots here is meant to represent like a server. And in using blockchain terminology, we call these nodes. These nodes each contain a copy of the entire ledger or a specific version of the ledger, but it's intended that there's no single point of failure and that each of these servers can communicate with each other. There are many, many different types of blockchain platforms available. The ones pertaining to cryptocurrency that I was talking about earlier are referred to as public blockchains, where individuals can join. There does not require permissions, and these offer transparency of these transactions. This is how it was designed intentionally for cryptocurrency so that it could be a trustless system. But when we use healthcare or banking information, it's all private. And so with the private blockchain that I work for, the information is private and people can only access that information with permission. There are new types becoming more popular as well, where there's a private blockchain that involves permission only, and there are periodic backups to a public blockchain. And there are hundreds of different types of platforms that are used today. Some are private and some are public, and some involve proprietary technology. So this just reinforces the concept that blockchain isn't any one thing, but it's a class of technologies that can be developed in many different ways. So when we have all of those nodes that somehow have to communicate with each other, then it's important for them to have a mechanism to which to agree upon which is the latest source of information. So that's why we need mechanisms to reach consensus. And so these are called consensus mechanisms. Now, you probably heard that, blockchain causes a huge drain on the environment because it uses so much electricity. Well, that is true, but only for one type of consensus mechanism that's typically used for cryptocurrency. Other types of mechanisms that organizations use to reach agreement do not use any more electricity than central servers. And while proof of work, which is the consensus mechanism used for cryptocurrency, is slow, other forms are fast and are much better suited for the nature of private information. So the most important thing to take away from this is that if you've heard that blockchain uses a lot of electricity and it's terrible for the environment, that's only one type. So the next consideration is that blockchain employs can employ, and for most modern uses does employ, what are called smart contracts. But this is a misnomer because these are not contracts and they're not necessarily smart. These execute, what it is that there's a layer on top of the blockchain that adds snippets of code that can automatically execute when certain conditions are met. This offers automation for like automatically generating payments, for example, when a product is received, or can automatically update inventory and maybe even perform the ordering. So the goal is that these can make our processes so much more efficient and can reduce error. But it's always worthwhile to know any form of code involves potential that a human had entered something incorrectly and that there could be bugs. When we think about blockchain systems, there are a few different ways that these can be designed. And one is an all-in-one system where it's a brand new program involving blockchain, and all parts of it, including our login and user interface and all of the software we interact with, were all designed together to work with a blockchain. A blockchain provides typically layers underneath what we are used to seeing for our software. So this is one way that it can be designed. But the most common way that it's designed is where the applications that you are familiar with, the software you already like, can simply be connected to a blockchain. And there are layers underneath for smart contracts and for the blockchain to process information. And this can actually improve the efficiency of some of these systems because it is a very effective way for software programs to communicate with each other in ways that they hadn't been able to do so before. So going on to talk about how blockchain can connect assistive technologies, there is a huge need for blockchain. This isn't just like science fiction or a technology of the future. In fact, even as early as almost 3 years ago now, half of global healthcare companies stated that they planned to develop blockchain projects in the immediate future. And as of last year in 2020, 70% of life sciences executives said that they planned to implement blockchain. They were looking to achieve some of these purposes that I was just talking about with system interoperability and better improving the nature of healthcare and delivery. So I'd first like to start by sharing with you an implementation that you probably interact with every single day and don't even realize it. If you shop at Walmart, you interact with a blockchain. So starting in September of 2019, Walmart implemented a blockchain to track much of its produce. Not all yet, but most. The problem is that when produce was picked at a farm, it would get all aggregated by a shipper and then put together and kind of all mixed and matched in a central warehouse for distribution. And there was no way of knowing which produce went to any store. And the problem is what happens when there's a recall? Typically, then all of the produce in the United States must be pulled from the market for safety because no one had any mechanism to figure out whether produce came from a contaminated farm. So Walmart created a blockchain-based food supply chain where a farmer has a barcode or QR code on each box of produce, and it's scanned with a simple smartphone. And then every time produce changes hands in the shipping process, distribution, or even when it gets to the store, every single handoff is tracked. And so then in the store, a produce manager, for example, can click the code and see the entire history, including the date that it was picked at the farm and which farm it came from. In some areas, consumers are given QR codes that they can scan and see the entire history of the produce themselves, including finding out which farm it came from and the date it was picked for freshness. So starting in September 2019, Walmart declared that all members of the process of the supply chain had to adopt this blockchain technology, and Walmart provided it for free in order to ensure that the produce could be tracked from farm to store for most of its products. And now when there's a recall, a produce manager can take out a smartphone, pull the QR code, and make sure for each of the produce that if there's a recall, that he could only pull the produce from that contaminated farm and otherwise be confident that the produce is safe for consumers. So as we think about how blockchain can enable some features that are valuable to assistive technologies, one of those features that's really important and really improves the ethics of how we engage with each other is a concept called dynamic consent. And this is a topic that's very dear to me because we want to give people as much choice as possible of how their information is used in ways that they have much more specific capabilities. So when using a process where a person performs agreement, it doesn't have to be formal informed consent, but it can even be specifications within software or moving a slider on an app that the blockchain records exactly what a person has agreed to, and only that information, however granular, goes to individuals who are given permission, even if those individuals aren't part of the network. And a person can change his or her mind at any time in order to best reflect their preferences. And these smart contracts are also used to automate alerts and reminders about medications or refills or safety issues, as well as reduce change that access for people who used to have access. Also, when we think about all of those sources of information that are out there about us from different pharmacies, from different healthcare providers, from different wearables, for example, it's really important to pull this information together. And so this information can be pulled using simple, they're called application programming interfaces, in order to connect this information to the blockchain where it can be all aggregated and accessible only to those individuals who were given permission. So as an example of a real life product that uses blockchain is a product involving life documents. So that's not what the company's called because I'm not promoting, but in this online website, information that people enter about what they would want to have accessible to their loved ones is all stored and secured with high security using a blockchain. And it can be accessible to the loved ones or caregivers in the event of an emergency. And the permissions for who can access it can be changed very easily and at any time. As another example pertaining to assistive technologies is the capability of integrating electronic systems very easily. So many times people can use an automated or electronic medication solution that automatically sends a message to an app as to whether a person has taken their medication that day, as evidenced by opening a bottle. And it can be that they have a smart watch that helps track their movements and can detect when they have fallen. Medical records can also be included. And so all of this information can be pulled together on the blockchain in ways that they could not communicate with each other otherwise, so that there's a single view as to how well people are doing. So this is a product that I worked on with for a grant for the state of Wyoming, where the goal was to pull multiple sources of information together to determine whether individuals were at risk of falls. And so elderly individuals who wanted to age in place, but there were some concerns from their family, they could go through balance testing, a short test on vision tracking when they were looking at a website, and that there were receptors on their head that wore a little cap, and as they would listen and speak, their programs could detect whether they were depressed or agitated and what their mood was simply from processing speech. So this can all be pulled together in real time for a doctor so that the doctor can see all of these statistics in real time and determine whether somebody is experiencing some health complications that would reduce their ability to be independent. And as another example, and this is something that my team has been working on lately, is taking together all of these daily living activities, such as an electronic pill minder and a smartwatch that can detect GPS. So if someone goes for a walk, it tracks them through GPS, or it can also detect if they fall or if they even have arrhythmias in their heart condition. We recently updated it so that it tracks their COVID results, and it pulls all of this information using a blockchain in real time so that all of it's available in a dashboard to know at a glance how the patient himself or herself is doing, and it's visible to loved ones as necessary, or even physicians. So the goal is using technology and pulling it together so that individuals can have more safety oversight. Now, while this all sounds really good, I also want to point out that blockchain doesn't solve every problem. And it really does depend on what is the intended use and how is it intended to be, and what are some of the additional features, such as cost. So now that we've learned a little bit about what blockchain is and how it's currently being used for assisted living, I'm going to share with you some ideas about questions that you can ask to make sure that it can be operationalized in a way that makes the most sense for the organization. So I like to point out by saying, because my background is in both research and compliance, is that we always have to be aware of both the operations and compliance and make sure that it's done responsibly. When we deal with information such as wearables or health information, really anything pertaining to aging in place, there are lots of different regulations that could apply in order to protect the privacy of that information. And there are many different blockchain systems available, and they differ in how they address these privacy requirements. I like to add a caveat: beware of vendors that claim their technology is compliant. And the way that I answer that question is with another question. Is this car speed limit compliant? It can be, but not necessarily. It can be designed to meet the speed limit requirements, but technology alone cannot offer many of the additional components that are necessary to ensure that we're implementing any system responsibly. Technology alone cannot provide ethical behaviors or system maintenance or write the privacy policies and perform assessments. Instead, technology is only one part of the data ecosystem that includes a comprehensive assessment of how well it works in an organization and what is that company's due diligence to protect privacy. I like to point out that it's important to know who will ensure best practices of any technology being used. As you were contemplating using technologies for yourself or your loved ones, I provided some questions for you to ask so that you could feel very informed about how best to pursue any form of technology. First and foremost, always read the privacy policy. These are just a few examples about access and sale and breaches that you should know about, but it's also learning about how can we share this information as needed? Can we share it with the physicians? Can we opt out of any data sales or sharing? It's really sad how often our information is sold without our awareness. And how can we change the process for who has access? Is it easy to do? Do I need help to do it? And how do I ensure that my family member has access to information in an emergency? Now, here are some additional questions that start to pertain to the complexity of blockchain. But first and foremost, we need to know, at least at a high level, what mechanisms are in place for the system to ensure security, and what kinds of testing do they do? If they're using a blockchain, does that introduce any additional security risks? Typically not, but we still need to ask because it really does depend on which platform is used. Since many of these services are new, what happens if the service provider goes out of business? And what will happen to my data that have been collected and stored by a company that went out of business? Or how does the organization meet the privacy compliance issues? And as we think about backup and storage, why that's necessary is that you and your family may have put a lot of effort into entering information, or at least ensuring that everything was set up the way you wanted it to be, and what would happen if the system went down and you had to re-enter everything. It's just valuable to know what is the company's practice about making sure that that information will always be available when you want it to be available, and that the system doesn't go down. And the last question to ask is, what happens if we leave this service and decide that we don't want to use it anymore? Can we download all of the data that were collected about us? And can we ensure that our information will be deleted from that service if we leave? So in conclusion, I'd like to end with a quote here that was by my supervisor, Frank Ricotta. He says, "The future of healthcare will be driven by data, and blockchain technology is the enabling foundational technology." And so now I am receptive to find out any questions that you may have about blockchain and assistive technology.
This was a lot of amazing information, and I know quite a few people are probably going whoosh, because I know I was when you and I first talked in what, October, November,
Sure.
when we spoke, and I know I was still like, what did you just say? So I would love to offer opportunities for people to ask questions, because this is your chance to have an expert in this field to discuss more about what blockchain is, how it's beneficial, what is it, you know, what more about it is there to understand about the technology aspect in your residents, your patients in a nursing home setting. So please, you know, feel free to ask your questions. And Dr. Charles, if you don't mind, stop sharing your screen so we can see who might be raising their hand or coming available. There we go.
Okay.
Please don't hold back, everybody. I mean, like I said, this is some information that blew over my head, and I only had 10 minutes to learn about this, and she breezed through it, and I had 10 minutes to go, what just happened? So you at least had 30 minutes. So feel free to ask any questions that you may have in regards to this truly impressive. I signed in a little late, but how does it facilitate aging in place? Somebody had a question.
Okay, so for that question, it's really about how do we monitor people who wish to age in place so that they feel like they have, there's appropriate oversight for them, that they're confident. So while there are a number of wonderful programs and technologies that can provide additional insight, one of the challenges is the ability to integrate them and see at a glance how a person is doing across multiple programs. So for example, for the activity that we are working on with the state of Wyoming, the goal was to have a physician involved and for the physician to have some real-time access on how a patient is doing. So like, for example, with the spoken language, a person would have to recite a very short script, and there are computer algorithms that interpret that to determine if someone really isn't having a good day, or are they sounding depressed. Computer programs are so sophisticated that they can detect that. And then for a physician to have access to that information, and perhaps information about their wearable in the same piece, say, is that person much less active right now? Is this a person who might need an additional visit? Do they need to come into the office sooner? Or for family members to make sure that by seeing everything, instead of looking at each piece of technology individually, by being able to see it in one place provides a much deeper insight as to how someone might actually be doing when they are trying to age in place.
Wow. Hope that answered the question, Ms. Nanette. Does anybody else have any pondering questions? I know you probably do, you just don't want to share it, but please ask the question to our amazing doctor. Does anybody else have any other questions?
If you don't have questions, I have some questions handy.
Okay,
so
go ahead.
I could keep talking for a little bit. I am often asked, why would you use a blockchain instead of a database? And so that's a very legitimate question. And there might be some situations for which a database is the best solution, especially if it already meets all of the needs that you have. Where blockchain becomes more helpful is when there are gaps in what the traditional technologies can offer, and there is a need to either pull together information or automate some features, such as alerts and having a push message to go to a family member saying, you know, your mom hasn't walked more than X number of steps today, or they haven't taken their medication this morning, might want to check in on them. And you can automate that in order to make these systems work more effectively together. Another feature for blockchain versus the database is also the ability to change the settings much more easily. With current software programs that we use to manage technologies, we have to build into the software using programming code exactly what we want it to do. But with blockchain, there are tools available that can allow for much more flexibility on how the information is either shared down to, you can share information down to from your entire medical record down to a single data point. And you could even say, well, I'm going to try a new physician, so I'll give him access to part of my medical record for 7 days. And all of that is automated in that access so that you have more control over that information. So those are just some additional examples. I specialize in life sciences research uses of blockchain, and we have hundreds of different uses that are currently applicable. And so there's really no limit at this point about the ways that it can achieve different purposes beyond what traditional software and databases can.
Okay, we had another, Nanette was adding to her question, that the first question that I asked, and she said, how would the individual tap into this product?
Sure, so there is one product that I talked about that is commercially available. And so that would be a service that you can sign up for. Otherwise, for blockchain in general, it's often developed at the organizational level, or as we're starting to see more commercialized products that would have relationships with many of like the wearable providers, like a smartwatch. Most of the time, like for the things that that I am part of, we are designing it for an enterprise to make available to its members. So I think we're going to see a lot more consumer applications. And if anyone has a burning desire to learn more about any particular uses that involve a commercial product, I'd be happy just to talk to you offline about that.
And then I had another question. Are weather alerts part of blockchains?
They can be. In fact, for life sciences research, many of our academic partners who study asthma build in environmental factors where it automatically downloads from the CDC and from weather alerts in order to determine whether there will be increased risk to individuals who have respiratory problems. And the beautiful part is that you can integrate, we call it like a life profile, where an individual can connect information from what their neighborhood pollution is and what are the medications that they're taking and what are the risks for weather. Say that it's going to be icy. Is there going to be a greater fall risk? And all of those aspects can be connected and create alerts so that either healthcare providers can be more aware of risks, or even individuals can be pushed to a technology device like an Alexa Echo Show or something, or a Google Home, where they can see like alerts saying, hey, it's going to be icy later today. So those are some exciting things that are being developed. One thing I'll share too is that the technology is easy to connect. The politics are hard. And so we
That's
can
true in
connect.
a lot of things.
Like for example, some of our partners connect their electronic health records from their hospital system to a blockchain. It's easy to do from a technology standpoint. It's really hard to get approval to do that. So there are many, many creative ways, and pretty much any source of electronic information can somehow be connected to a blockchain in order to facilitate access to that information.
It's truly impressive information, if I do say so myself. And it's constantly, my mind is constantly going, trying to wrap my head around it. But, I don't want to go too far over our time. So if nobody else has any questions, I'm going to stop recording.